The cover of the book, to me, it's a combination of a few things. It has what I call there's creative tension. In some sense, it's kind of alarming because of the way I've shot it. Simply placing the character so far on the edge, and then combining that with this delicate rose petals falling. This picture, to me, is very much a kind of a mood picture. It says really the simplicity of the hospital, this one light bulb lighting the hallway. So it's very much just getting a sense of place and just getting a sense of the atmosphere. In this photograph, what I like about the picture is that the needle hasn't actually gone into his arm, so that there is this sense of a moment. Many of them have negative reactions. They struggle with taking the drugs, but they all know that by sticking to the drugs that they have this second chance. The next picture is a young gentleman. His name is Dennis. He's an interesting young man who really has relied on his faith to give him that strength in his moments of doubt. I was attracted to this scene because I was told by the staff there this is a process that they go through to test each glass plate, there's a TB smear on there, and this was just a good combination of light and moment and color. So this next frame is actually a mother, and she's going home to her mountain village. It's an incredible landscape that offers mountain peaks to small rivers in Lesotho, and this is a 7-hour car ride from the capital, and then a 2-hour hike deeper into the mountains. She's not only a mother of several children, but one of her daughters is a MDR-TB patient. On top of that, she is a healthcare worker who volunteers and assists a lot of her neighbors within her community. This next page is 4 pictures, they're all combined from different places. The upper left is a doctor who is visiting in Lesotho and working there, and he's actually inspecting, looking right into the mouth of a patient who's being treated for MDR-TB there in the capital of Lesotho. The next frame over is basically just a nice simple detail of some chest x-rays of a patient with MDR-TB. It was just a combination of the window light coming in and hitting them, as well as just the information of the patient. On the lower left is just a nice scene setter of this young girl, Charlene, and she's walking hand in hand with one of the doctors in Manila, and she was taking her home to show her where she lived, and so that she could visit with her sisters and her family. And the picture to the bottom right is just another outdoor scene setter where it's a former MDR-TB patient who's testing negative, and she's visiting with a community healthcare worker there in Lesotho. I included this one because the love for the husband that he had for his wife, and every day he would storm the clinic by carrying his wife, and basically come in very quickly, and he would find an empty chair and he would gracefully place her into a chair. And in some cases then he would carry her to a table and assist her in taking her drugs. And the next picture is, in some sense, it's a very heavy picture to me, because it's a mother and a son, and they're waiting to hear the test results of the mother, and the mother is suspected of having MDR-TB. So they're patiently waiting, and at the same time there's this this nervousness, there's this posture, and then there's this silence where they're observing other patients, but at the same time they don't want to simply observe it. This photo struck me because she had a real sense of peace in her, but there was this conflicting, silent stare, and her movement was minimal, even though her health didn't seem as bad as some of the other patients. And this gentleman here, we were on the morning rounds. I was on the morning rounds with the doctors, and one of the doctors was telling one of the other doctors that he's improved, that he has some more strength, and they wanted him to demonstrate his ability to kind of walk. And it was just this interesting moment where when he stood up and he eventually saw himself in the mirror, and he insisted that he wanted to brush his teeth. It was just like this nice moment. The image on the back of the book is one of my other favorite images, and it's of a MDR-TB patient who has newly returned to her mountain village, and she's smiling at one of her kids. So there's this kind of this grace to her, and that she's proud, and that she's back. There was still this sense of returning home and being present and being alive, and when in some cases, like one of her sons feared that he would never see his mother alive again, and so it was a great homecoming. To me, throughout this photo essay, it's that dignity and respect that the doctor has. It's that love and that care, and they're trying to capture that observation. That to me is kind of my role. My role is trying to be a responsible photographer, and by building that bridge, the viewer then becomes a witness to this, and in hopes that maybe they take action.